Hello and welcome to the Kidneyally Nutrition Podcast, the one and only podcast where we tackle the hardest questions around what constitutes a good, healthy kidney diet. Whether you're a patient, a carer, a nephrologist, or a dietitian, I'm sure you'll learn something new today about what constitutes a good, healthy kidney diet. Hey guys, I'm Carl Juresic, your co-host and co-founder of Kidneyally. I'm a kidney transplant patient, and we're here today to talk about all about potassium. And I'm going to pass on to my co-host now and co-founder of Kidneyally.
Hi everyone, I'm Ruth Kander, dietitian in London, and I have been a renal kidney specialist dietitian for 20 years and love just chatting to Carl about all different things. We've been having a great time. And all good. So shoot.
Yeah, I've actually really enjoyed these podcasts, as in because we're trying to build the website for Kidneyally, and I'm like, it's not like they're boring conversations, but when we tend to drift on to talk about kidney stuff anyway and the other stuff. So I feel like this is like getting more solid output in regards to all of the questions we're seeing, and I'm learning so much myself from doing all this stuff. But on potassium, I find like potassium such a controversial topic because it's in the group. A lot of people talk about potassium, and I myself, for some reason, never was trying to avoid potassium. The word seems quite scary, but like maybe to kick us off, it's like understanding what the hell is potassium and like why, if anything, is it different to like calcium or other things for the kidneys, and why do patients end up not needing to do stuff and eat it?
So potassium is a mineral, and it's found in many foods, and it's very important in the body in terms of it's very involved in the function of muscles. Okay, and you need potassium for the muscles to work, and in particular is needed for the heart muscle in a particular quantity and at a particular level. And this is where the whole thing about potassium kicks off, because if your potassium is too high or too low, then that can affect the beating of the heart, because it affects the muscle of the heart. So it affects the beating of the heart, and you can go into a abnormal heartbeat and therefore a cardiac arrest. And that is why the word potassium is so scary to everyone, and everyone gets so frightened, about potassium, and everyone thinks that because they're a kidney patient, they need to avoid potassium containing foods, which is completely not the case unless you have a high potassium level. But just to say also, usually the only other time that potassium is a problem is in heart patients, and commonly in heart failure patients, so patients whose heart's not working so well, then they can have problems with potassium, and they can go too high or too low as well, and they also need to watch their potassium level.
So with the kidneys, and what is the correlation between kidneys and potassium? Is it similar to kind of like protein, where if your kidneys aren't functioning very well, it doesn't drain it properly? Or like, why do you get high potassium if you've got kidney issues?
So yeah, you've hit the nail on the head. So if you've got kidney issues, your potassium can go high because your kidney cannot get rid of the extra potassium your body doesn't need in the urine. So normally you've got potassium in your urine that the body gets rid of, but it doesn't need, because the body is very good at adjusting itself. So it will get to a particular level and it'll think, right, I've got enough potassium, I don't need the extra, goodbye, it goes in the urine and you wee it out. And if that's not working well in the kidney, it will just accumulate. But it doesn't normally happen unless your kidney function is less than 30%. But sometimes some medicines can cause you, that you need to take, can cause you to retain potassium. And then you might need...
Oh, sorry, if you want to finish that bit there, about...
And then that's the reason why you may need a low potassium diet when your kidney is actually not too bad, because those medicines that you really need to manage the kidney, you need to follow a low potassium diet with it, because it causes your body to hang on to them.
So that's exactly what happened to me. So the reason why I had a kidney transplant about 10 years ago it was about 10 years before that, I had a really acute bout of vasculitis. And because I was only 15 at the time, and I remember so distinctly like having jokes in my family about potassium, because I was on medication that meant I needed to avoid potassium. And so yeah, in my family in Australia, it was always funny jokes around bananas. I can't eat bananas, and I used to love like tomato paste. We had like a family thing we made with tomato paste and pizzas. So like I couldn't eat these things. So I became really obsessed with what was high in potassium. But then eventually, once I stopped the medication and I just had CKD before my transplant, there was never any mention from my doctor about managing potassium ever.
Mm, mm. Yes, so that's common, and I think that the problem is that we've seen, and you know, I mean, like you said, you've learned so much from this group. I have learned the most enormous amount that I've ever learned, you know, about the general public and their perception. And there's a big perception that potassium is damaging to the kidneys, and that is 100% not the case. And actually, fruits and vegetables are really essential parts of a healthy, balanced diet for maintaining good kidney health and good health. So really, you should not be avoiding it unless you absolutely have to. So a few years ago, the government decided to put potassium chloride in crisps and snacks instead of sodium chloride to help manage the epidemic of hypertension in the UK. And actually, the kidney community lobbied that, but didn't get anywhere. So, and I've had some people who have had high potassiums, we think from that, but not one of the companies has measured the amount of potassium in their product because it's not a requirement. So
why is that? Because is that just a UK thing? Because like, where is it in other countries? Do they have? I noticed that there's no potassium on labels, which is really annoying. Because I mean, to be honest, I don't follow potassium diet at the moment, but whenever I've looked for it, when we're doing recipes for what we're doing with kidneyally, I'm like having to look on different apps for potassium. Is why if potassium is so important for the body, why isn't it on the labels?
Because it only affects the kidney community, potassium, really, at the end of the day, and it's not large enough to warrant it to be mandatory on labels. I did notice, though, in the USA, it is now recommended to be on labels. But what I've noticed, which is really dangerous, I think, is that some labels say 0 potassium, right? 0 milligrams potassium, and that food product is known to me to be a high potassium food. So I'm not sure what is going on in the US. I've asked, but no one's really answered me. So what I would say is you've got to be really careful. There's no real requirement across the world to put potassium because there's not enough demand for it. No one's demanding it. No one's lobbying for it. You know, maybe if the kidney community of the UK lobbied the government, maybe they would get somewhere, but I doubt it because it means that it's quite costly to measure all these things anyway. And so, because I guess you would need to measure it properly. You'd need to send it off for a proper food analysis.
Imagine the cost, like, as in the people making the products is probably just looking at how much it costs to make, and then
yeah, and they probably just work out the calories and protein by whatever they do. I mean, if they're using a food composition tables, like, you know, the software, then maybe that's all they're doing. They just put the ingredients in. I don't know. I'm not exactly sure. I actually wanted to send off a packet of crisps from a well-known crisp company that was using potassium chloride, but it was £150 to just get one packet analysed. So I thought, you know what, I'm not doing it for that. If it was less, then I probably would do it. But I would love to know how much extra potassium it adds to a product, because potato crisps are mega high potassium anyway. A packet of crisps is really high potassium. It's probably about, I don't know, 400 milligrams or something. So I don't know how much extra that potassium chloride adds to it. And also there's the whole absorption. So absorption of food additives is a much higher rate than actual food in the body. So they're saying, again, they're also saying that food additives like potassium and phosphate food additives are absorbed really quickly into the body and are much more potent than food themselves.
It's really interesting. I think that like with the measurement side, I'm sure that unless it's a natural food, it's going to be even harder to measure anyway. So like, for example, anything that's processed or anything that comes in not fresh is going to be clearly questionable of how much potassium that has. So how would someone that does say have issues with potassium, how would they know what is and what has potassium? Because I think that's the biggest question we get. One of the biggest questions we get in the group.
Yeah.
I need low potassium recipes. What is low potassium? Like, are there foods like really common foods to avoid and really common foods that are really good?
So there are, look, the composition of foods, you know, like Nutrimen and the online platform, you can see there yourself. That's how the diet sheets have been made. They've all been made looking at those food analysis tables and putting it into a readable format for the general public. And that's how we've done our low potassium diet sheets at work. We've, you know, looked at the potassium content and we've, you know, made it as low as possible. And that's how we've done it. And that's across the world, that what they've done. So I guess that's what you would do, but it's difficult. And also some of the information online is not very reliable. On our group, I've put the Oxford low potassium diet sheet because I really liked it, and it will be reliable. So I thought it was a very nice diet sheet. It was very nicely put together, and I thought it was quite sensible as well. So there's that, but there's also like the app Nutrimen, but you just need to know how to use it and having guidance. And I feel that because of low literacy generally in the public, we don't really teach people how to use it. And I've been teaching people how to use it. People who are young and with it and got apps on their phone, I teach them how to use Nutrimen. And I say to them, anything more than 200 milligrams of potassium is too high. You know, you want to look for things 100, you know, and I go through it with them and I show them. I've made a little a guide which we can add on to this of what to look for, and you really don't want to eat more than 2,000 milligrams a day. It's a general, very general rule.
Is that the overall recommendation for someone in just average Joe, that for 2,000 milligrams a day is what you'd recommend for anyone to eat? Or
no, 2,000 milligrams would be for someone who needs to watch their potassium level. I think for the general public, I think the recommended daily amount is 3,500 milligrams a day. I'll just have a look.
And then I think that's one thing that a lot of people ask in the group is, I need low potassium recipes. I think the main thing people need to know is just keep track of, you know, what you're putting in your mouth, and knowing if 100%. Over time, if you're knowing that, to your point, if particular, whatever it is, some broccoli is 200, you're just trying to get to about 2,000 in a day. Just don't eat 100 broccolis. Do you know what I mean? Like, it's fairly straightforward. But is there particular foods that are like crazy in potassium, like really, really high?
Yeah, potatoes, crisps, chips, really high potassium. Cassava chips, plantain, yam, green banana, really high potassium. I guess root vegetables, parsnips, very, very high. Spinach is mega potassium. So those kind of things are really particularly high. And then you've got the medium, so like things like tomatoes, bananas is moderately high potassium. And again, it's easy to eat. See, the problem is it's easy to eat too much. So and to eat, you know, people don't eat just this much or just this much. So it can be quite tricky, and that's why there's a low, medium, and high category, and that's how we categorize foods generally. And we've got our own cutoffs in the back end, if you like. And that is kind of seems to be.
You mentioned banana there, like as a ballpark. How much potassium does a banana have?
So I'll just have a look, because I don't know off the top of my head. But it was right about the crisps, actually. It was 400. Here, 330 milligrams for an average banana.
But
So
this
that's
is
quite.
a crazy thing, because if, like, for example, if you're on a really low potassium diet, like a 2,000 a day, half the daily dose, people can have a banana though still, right? Like, as in,
Yeah,
like, you can, I think that people get, when you read in the group, people, I did this myself, like, you just stop eating it because you stress out, that people say limit your potassium. But like, if you really love bananas, have half a banana every now and then, but just the rest of
absolutely,
the day without
exactly.
potassium. You don't need to stop. Again, in the group, people are like, oh, I love tomatoes, I love these things. I think even on people on dialysis and people that are really low on potassium, like, you can still eat it, but just be very careful for the rest of the day on not going overboard. Because a good example of that is, before, we started this stuff with Kidney Ally, I'd never eaten for 10 years. I loved dried apricots. Potassium is actually normal. I went and bought some apricots. I didn't eat the whole packet. I just ate a few, and then I've been eating them over the week. But for someone with normal bloods, I don't need to actually worry too much anymore about potassium. So even if I had really issues, I probably could eat one every now and then. I wouldn't have to just strip it from my diet.
Exactly, exactly. I have to say, if you're on dialysis, it's actually sometimes a little bit easier, because if you're on dialysis and you dialyse well and you're compliant with your dialysis schedule, and you've got good clearance from the dialysis, then actually you can get away with eating a bit more than when you're maybe in stage 4, where you've got to be really strict. And again, this is where the whole stages things come in, and knowing your bloods come in, because there are times where you need to be mega strict, and it's really horrible. It really is. When you're sitting on that fence of, not dialysis, do dialysis, it's you've got to be very strict about what you're eating. And even if you eat, a little bit, it could make your levels go up. But then when you're on dialysis, it's being cleared. So it's being cleared for you, so you can be a bit more flexible. And then again, in transplantation as well, even sometimes people have problems with potassium who are transplanted. Doesn't always work brilliantly, or it's not thing. Again, you can get away with more. So again, it depends on what medicines you are, what stage you're at, and what your body's doing as well. And it's quite hard to know, but you do, from the bloods you can know, and that's why you need to know your bloods really well.
Yeah, I think that's kind of that overall advice, is in, like, have those discussions about your bloods with your doctors or your dietitians, and make sure that you ask these same questions if you're worried about them, instead of assuming. But if I was to say, there's a lot of people in our group that seem to not be able to afford dietitians, or kind of very rarely see the nephrologist, or have poor experiences with their nephrologist. If they look at their bloods, like, what is the range of regular?
So it's just the normal range of potassium. So someone said in the group, actually, I noticed today that their potassium was 4. So the range is 3.5 to 5.3. And I noticed that's in all the countries. So it's millimoles per litre. It's in all the countries, it's the same range. So 3.5 to 5.3 millimoles per litre. And as long as your bloods are in that range, that is absolutely fine. So even if it's 5.1, that's fine. 5 is fine. 4 is fine. Like, there was one lady today I noticed, she said she wanted it less than 4. And I was like, it doesn't need to be. It doesn't do anything. Like, it's not damaging your kidney. It's not doing anything. As long as within the range, that is what you want.
Yeah, because then your body's just doing its thing. It's in the regular range, and then kind of like, then look at it like a seesaw. So, as in, like, just like you would for anything, don't go out and eat 40 cheeseburgers. Don't go over the top and eat 10 packets of dried apricots, because you're probably going to hurt yourself. But I think it's really good advice, because probably one of the biggest things people ask is, like, I'm looking for low potassium stuff. It's like, well, yeah, look at potassium, but just keep it reasonable. And especially if you've got no problems, you can look at yourself just like someone does in without CKD or without kidney issues.
Exactly.
Got a bit of a curveball question for you. Like, what is the most interesting potassium story you've heard from a patient before? Either someone that said, more like a ludicrous story that people have gone to with potassium. Do you have a story about potassium?
I don't know what it is that I've got. What I love is that And as you all know, I see mostly dialysis patients all week long. And, often I get, the nurse says to me, oh, their potassium was 6, or their potassium, which is too high, or 6.5. And I'll go and see the patient, and you'll have two types of patients. You'll have one who says, I know I ate 2 mangoes, or I know I had fish and chips, or I know I just really fancied eating 2 avocados. And I'll say, fantastic. I love the fact that you did that. And I think it's actually good for you to see that doing that makes your levels go high, because then it shows you that I'm not talking about low potassium for no reason. So, and that's fine. And then they say, I won't do it again. And then usually they're a non-offender, and it's, they don't offend again, and it's fine. And then you've got the other types of people who say, I didn't eat anything I shouldn't have eaten. I don't know why my potassium is so high. And then you're a bit stuck, because if they're dialyzing okay and all their other results are okay and just their potassium is high, you can't tell them, they're lying, and you can't help them really, because you don't know why their potassium is high. Once you're on dialysis, the medicines cannot affect.
The only way you'd actually have it high, because the only way to get potassium in your body is with food, right? Or with what you consume.
Yes. I mean, blood, sometimes blood transfusions can make potassium go high because it's the protein in the blood. Sometimes, but usually not a problem. Or sometimes, if you've got really uncontrolled diabetes, the high sugar level in your bloodstream will cause a shift in potassium to come out of the cells and make you have a high potassium. But again, not so much in dialysis patients, but in CKD, yes. So people who are very uncontrolled diabetes can get high potassium levels earlier than if they didn't. But those are my 2 main stories. I've had sad situations where I was really new to being a kidney dietitian. It was in my first year of being a kidney dietitian, and I didn't know anything at that point. And this was 20 years ago. And there was a young girl, and she had multiple myeloma, which is one of the cancers that can cause kidney failure. The only one, actually, multiple myeloma. And she was really young, and she really liked high potassium foods, and she kept bouncing in and out of hospital with a high potassium, and I kept advising her, and I thought I was telling her all the right things, and in the end she had a cardiac arrest from a high potassium. And they complained about me that I hadn't educated her well enough or told her the right things or whatever. I was really lucky because they completely protected me, the trust, and it didn't really go anywhere. They just told me that this was happening and they were dealing with it. I didn't have to do anything, but I was really upset. And to this day, I always make sure, as best as I can, that people are knowledgeable about what is high potassium and what is low potassium. And as long as you are confident that you've told somebody, these foods are high potassium, these foods are low potassium, that is all you can do. You can't do any more. You can't go home and make them follow a low potassium diet. And that's why, when people present with a high potassium and they say to me, oh, I don't know. So I'll say to them, do you know which foods are high potassium? Then they'll reel off a whole load of foods. So I know that they know what's high potassium, what's low potassium. And then I'll say to them, do you want our sheet again? Or do you have our sheet at home? Is it handy? Yes, I've got the sheet at home, I'm fine. And that's all you can do. It's really, I really struggle with that enormously. And then there's others who you might not have educated because they didn't need anything. And then they come with a high potassium and they tell you they've been eating loads of baked potatoes and chips, or they've gone very healthy and they're eating tons of vegetables and they're baked and grilled and loads of salad every day. And you're like, I'm really sorry, but you can't do this because it's going to cause a high potassium. But funny stories, sorry, not. I wish.
Yeah, the way that funny is quite a lot dark, but all the same thing. I think it's the same concept over and over, that like the takeaways really from today was around, firstly, know your blood levels between 3.5 and 5 milligrams in. Go look at your previous bloods. Where do I sit? Am I in the good range? If I'm higher or lower, why am I higher or lower? Discuss that with your dietitian to go, what should I be doing? And then look at the average amount per day, which is 3,500, 4,000. And then if you do need to lower that, work with your dietitian or your nephrologist to figure out how much lower you need to go, and kind of look at it like a seesaw or like a glass where you fill it up every day and your kidney needs to remove it. So I think that's kind of the takeaway. And I think the main thing that people need to know if they're worried about where to find potassium food is then within that Nutriment app, which is like in the app stores. Just have a look in Google Food, or not Google Food. Look in the app because it will tell you how much potassium there is in a serving. And then that's medically verified. It's not going into Google or other Facebook groups and figuring out that, like, you know, there's miracle cures over here and there, because you need to know it from medical sources as opposed to stuff you read online. And then, yeah, so I think that's all the questions I had from today. Did you have anything else, Ruth?
I'm just trying to think. I think just be conscious of, you know, you're in CKD, you need to know your medicines and need to know your bloods as well, because some of the medicines do, like the blood pressure medicines, so the things like irbesartan, losartan, ramipril, captopril can affect your potassium levels. If you've got heart issues and you're on something like spironolactone, which is a very high potent diuretic, which makes you get rid of water, that can cause you to accumulate potassium. Just be conscious of those. Do not switch to low salt, which is the salt substitute, because that is potassium chloride and you will get a high potassium from that for sure. And try and stay away from, you know, food ingredients that say potassium on it. Try not to have them.
Awesome. And also, if you haven't heard the podcast before and you're kind of new to us, go check out our Facebook group. It's called Kidney Disease Diet and or Kidney Disease Recipe and Diet. And it's got a beautiful picture of a nice big salmon and a salad at the front. So, and me and Ruth are the moderators. So join the group. And by the time this comes out, actually, our website will be much closer to being launched. So excited to bring lots of amazing recipes and education content and being able to see dietitians as well. So look out for that as well. And looking forward to speaking to you guys next time. Thank you. Cheers. Bye-bye.
Bye-bye.